he is doing. Is he okay? Okay, tell them you are there to help. This is very important as a human. May not be as a therapist, but as a doctor, as a tabbi, as a therapist, it is very important to improve the confidence of your patient. Saying that I am there, I'll try to take care of your pain. Okay? It's very important. You are there in this field for this purpose only. To relieve the problems of others, not your problems. Okay? To relieve the problems of others. So that communication is very, very, very important for me especially. Okay? How you are going to communicate, how you are going to behave with your patient is very important.
Also for physiology of patient.
Physiology and psychology of the patient. Okay? He will be very much relaxed as soon as you are talking with him nicely. Rather than that, if you come, where? Pain where? Shuf. Allah, nothing, no bar, go, bara. Automatically, the pain will increase. Pain don't decrease, pain will increase. So, it is very important to, first of all, convince the patient, okay, for your therapy. So, that solves half of your problem. Okay? So, once you rule out the contraindications, any tumor, any cancer, any problems, you can read the patient file also. You can find out if there is any fracture, any metals inside. For all the electrotherapy, it is common contraindications. Pacemaker, high blood pressure, not cooperative, or having ulcer, or having skin disease, or open wound in that particular area. All are usually common. So, you have to rule out all the contraindications. Then, importantly, sensation. If I am treating in wrist, I should ask, you are feeling sensations here? No problem? Okay, once yes, so then you can start with the treatment. Then you can say, I will collect some of the required apparatus for the treatment. Be comfortable in this particular position. So you can go back, you can set your machine, you can get the electrodes, cables, okay, the coverings, water, straps, pillows, towel, whatever is required for your treatment, it should be here. Not every time you go inside and get something. Inside go out and get something. So that indicates that you are not experienced. As soon as you do this, the patient will say, you are fresh. You are not experienced. You don't know what you are doing. Once you keep everything ready, automatically the patient knows, you know this. You know this is required, this is required, this is required for your particular treatment. Okay? So keep your electrodes onto the skin area. Now the next procedure, decrease the skin resistance. Whichever area you are applying, wrist pain, you can ask him here more or here more. Outside more means, okay, you can apply the water in that particular area, clean that particular area nicely. Okay, then put one electrode on the top, one electrode on the down, and put the straps.
Doctor, where cation and anion?
Here no problem. Okay, cathode, anode, anything you can keep. For the TENS, it is not an issue. Okay.
Where is important cation? Back?
Iontophoresis important.
Okay.
Okay. Faradic stimulation, galvanic stimulation important. Okay. Russian currents important. But TENS, it's okay, no problem.
Okay.
Okay.
Okay. I want.
So.
Think, please.
Okay, no problem. Yes. So go to electrotherapy. There is something called pain management. Heading is pain management. Go to pain management. The heading is biphasic pulsed current. In bracket, it is given TENS, TENS. Okay? Heading is biphasic pulsed current. In bracket, it is given TENS. The last semester, I have seen the students, they don't know how to identify the TENS. Because they are searching for transcutaneous electrical nerve stimulation, which is not there. It is there on the name of biphasic pulsed current. The heading is TENS. Okay? go to biphasic pulsed current. There are many forms: asymmetrical, symmetrical, burst asymmetrical. You can choose any of the alternating varieties preferably. Okay, now I'll choose the electrodes. See, I have put channel 2 for him. So I put channel 2. Okay, then I got the treatment time. If I am using chronic, then it will be 4 hours, 5 hours, 24 hours. If I am doing acute, it is 30 minutes. Okay, so currently I will set 30 minutes. Okay, electrode selection. You can use vacuum electrodes also. Okay, you can use vacuum, you can use carbon rubber, you can use plate electrodes, but not pen electrode. Okay, not pen electrode. Now pulse duration 100 milliseconds. Pulse frequency. Pulse frequency for chronic it is 2 to 4. For acute it is 90 to 130. So as I am treating like an acute patient, I put the time to 30 minutes. So I will set the frequency to 90 or 100, 110. So I increase it to 100, 114, no problem. Next, then frequency modulation. Okay, no need. Go to the intensity now. If I am using a high tense, what should be the intensity? Low intensity or high intensity? Low intensity. So I will try to give as much as he is feeling. You are able to feel the current? No. That's more. Little? Shoya or this? No. No, almost no. More? That's more. But you are feeling. Okay, so that's it. So whenever he is feeling, you can stop it there. And you can wait for some time. Slowly you can increase. But low intensity is sufficient when you are using high frequency turns. Okay? High intensity is required when you are using low frequency turns or low turns. Kalas? Okay. So this is the placement of the electrodes. So once 20 minutes, 30 minutes finished, you can again go back to time. If already time will be usually decreased, you need not decrease. So it is already decreased. Now go back to intensity and finish the treatment. Go back and complete. So I will finish. After the finishing, I will see the area, any redness, any burn, any swelling, any pain increase. I have to examine. Once it is no problem, fine. Fix the next appointment. When you can come again? Usually it is 3 to 4 times a day. Okay? If it is acute. So you can tell the patient you have to come 3 to 4 times or 2 to 3 times, whatever is possible for you. But as many number of times up to 4 to 5 times, it is more effective for you. Okay? You can come to the morning once 9 o'clock, then 12 o'clock, then 1 o'clock, then 5 o'clock, if possible. If not possible, then buy a machine like this at home, 200 riyals. I will show you how to apply. You can apply at home. So this is what you have to discuss with the patient and tell the patient. Once next appointment is fixed, then you have to wind up all the things. Wind up means whatever you are using, you have to keep it back neatly. Okay, there is no servants for physical therapist. Okay, you are the whole and soul boss, manager, everything you only. So you have to keep it back, everything neatly. Okay, so this is called winding up. Whatever straps you are using, pillows you are using, switching off the machine, keeping the electrodes back, everything is your job. Okay, so this is called winding up. Once you wind up, say bye bye to patient, then document. What I am going to document? What I should document? His name, then age, problem,
duration treatment.
what machine I have used first. Okay, what machine I have used? Tens. Okay, high tens or low tens? I used high tens here, 90 to 100, acute. Okay, high tens. Time, 30 minutes. Okay, frequency. Frequency of treatment, not the current.
93 or
Frequency of treatment, 2 to 3 times or 3 to 4 times in a day. Okay? Any problem? No problem. If no problem, after examination, any problem? No problem. Color, this much. Okay? And any, that's what. If he has any arrhythmia, any problem, then you write the problem. If there is no problem, no problem. Okay? Name of the patient, date of the examination, age of the patient, condition or treatment area, wrist, shoulder, neck, whatever the area, what machine you have used, tens, high tens or low tens, frequency of tens, treatment time, number of times in a day or number of times in a week, okay, or any problems during the treatment. No problems means no problem. So it is useful for the next person to treat this patient very effectively. Thank you, Khaled.